Hey, this is indigomusic.com. I'm Rohit, and today we have a very important topic that we're going to be discussing, and that's heart health. And to talk to us more about this, I've got Dr. Naveen Chandra GS, who's the HOD and lead consultant for Department of Interventional Cardiology at Astor Whitefield. Dr. Naveen, first of all, welcome to indigomusic.com.
Thank you. Thank you so much. Glad to be here.
Now, doctor, right off the bat, I want to ask you, what are the main causes of sudden cardiac arrest in young adults? As we are seeing these days, there was a woman who, collapsed on the stage during a Sangeet that was happening. And how can they be detected early?
Yeah, see, there is a very significant increase in sudden cardiac death and heart attacks in a younger population, even at a second or third decade nowadays. We see, especially in women also. That was which is unheard of in previous days. Women in the premenopause age group, it was very less likely to have any heart disease.
Correct.
But this increase in the surge of heart diseases are basically because of increase in the risk factor profiles. Now, we do see a lot more younger patients who are diabetic, lot more younger patients who are coming with hypertension, hyperlipidemia, lifestyle, stress. So the risk factors usually which were seen in fifth and sixth decades are being seen at third and fourth decade nowadays. That is the cause of a very high incidence of heart attacks which we see in a very young patients now. And also there is a very high risk, high incidence of obesity, smoking in younger patients, and the amount of stress what younger populations are going through. I think these are one of the few of the reasons why there is a increase in surge of heart diseases in young patients. Now, to understand, to diagnose, there are two types of diagnostic methods. One is to diagnose the risk factor. So we start, looking for risk factors like hypertension, diabetes, and high lipids very early. Like we start screening from the age of 20s nowadays.
Okay.
And second is to look out for heart disease. How can we screen? By doing simple tests like echo, TMT, we can screen, and patients with a very strong family history, we can do something like CT angiogram also to screen the patients with heart diseases.
Right. And how significant do you think is genetics in sudden cardiac death? And what precautions should families with a history of heart issues take?
Yeah, this is one of the commonest and one of the most significant risk factor for having heart diseases. Now, what do you mean by genetic or a family history? Is anybody in the family who has a heart disease before the age of 50 is turned as a family history of heart disease. Those people are at a higher risk of developing heart disease. So these are the people we try to to look for. Most of the times, these genetic are actually transmitted because of high cholesterols.
Mm.
So we need to screen them much earlier, and we need to start preventive aspects by starting an aspirin, cholesterol tablets, and factor, very strong risk factor, reduction as early as 30 or 40 years of their life. So it's usually because of high cholesterol. We screen them very higher. And also we try to do a lot more screening tests like CT angiograms, treadmills, much earlier than what we would screen for a normal population would be.
Right. And like you were mentioning about screenings, should young adults undergo routine heart screenings even if they show no symptoms?
Yeah, see, more than 90% of the patient would not show symptoms. So, an absence of symptoms is no way indicative of not having a heart disease. A lot of people will have their first symptom as an heart attack. So,
Right.
lack of symptoms doesn't mean anything. So, yes, of course, even there is no risk factors, no symptoms, we try to at least screen for the risk factors like diabetes, hypertension, cholesterols, etc. So, that kind of a screening starting at a late 20s or an early 20s is what is recommended. Yes, of course, they have a significant risk factor. They have significant family history. We can screen them for the heart disease by doing a TMT, echo, and CT angiogram in selected patients. So, absence of symptoms, no indication for not having a disease. Even if the patients with no symptoms, we still screen them for risk factors and heart disease.
Right. And before I let you go, doctor, I want to know for people listening in and people watching this video, what are some of the tips that you would like to give for them to maintain a healthy heart?
Yeah, see, it's quite simple. A healthy diet, exercise, 30 minutes of exercise per day is more than sufficient. 30 minutes of walk is what we need, at least 5 days a week. Something in moderation, maintain your weight, and do your screening test once a year. What that's all one you need to have a healthy lifestyle. And then I don't believe in doing something in extreme, because whatever lifestyle you follow, it has to be in moderation, because it is about sustainability. It's not only about doing things, it is about sustainability on a long term. Something in moderation, good lifestyle, and a screening for all your risk factors on an yearly basis. That's what you need.
Right, absolutely. Well, Doctor, thank you so much for taking some time out and having this wonderful conversation. Have a wonderful day ahead.
Thank you so much.